Hi, Dr. Tam here. So today I got asked a question, how do I choose a chiropractor? And this was from a private message on Facebook. So I realized that, there's a lot of choices out there. There's a lot of chiropractors in every single city, but how do you choose the right one for you? Do you want to choose the right one for you? Are you dealing with pain? Are you hurting? It's been years. You've done your stretches, you've done the exercises, you might have even done some of our exercises that I've shown, but you've taken medication, anti-inflammatories, and it just has not worked. If this is you, you need to listen up. Number one, how do you choose one? Well, you have to really be comfortable with one, but here's how I would choose one. This is what I told my sister to do when she was in LA, but of course, I make some phone calls and really figured it out for her. Number one, the key thing of figuring out your spine is you want to find a chiropractor, number one key, who is willing to sit down and do a consultation with you, who is willing to do an exam on your first visit. And for those of you, if I am speaking to you, you know who you are, who've had trauma, who've done gymnastics, dance, who've done football, hockey, baseball, some sort of intense sports, trauma, accidents or injuries, falls, X Games, snowboarding, everything, right? If you've done that, the chiropractor needs to have access to x-rays and is willing to take x-rays. So the first day you're gonna go in, now that's what we do in our office because I believe that we want to take the best care of our patients. We sit down for a consultation, we do an exam, we take x-rays, okay? Now, can you get adjusted without taking x-rays? It's possible, okay? It's possible, but if you've had trauma, if you've had prior injury, broken bones, and things that's been really chronic, it's been going on for a long time, wouldn't you want your chiropractor to know exactly what's happening on the inside? I know I would, right? So you want that. You want them to have access to that in their office. Now, usually then they would look over everything and the following day they'll have you come back and really go over your details with you. Now, how do you know if they're doing the right thing? Now, let's say you have a neck issue, okay? They need to have, number one, of course, they're gonna adjust your neck, but they should have some sort of stretching exercises, rehabilitation exercises, really to show you what to do to really help you go through your healing phases and your healing journey. They should put a program together for you that will map out, okay, where you are right now, where are we trying to go, and how are we gonna get there? It should not be, okay, let's get you down, let's get you adjusted, and come back when you feel bad again, right? That is not, you do not want to choose someone who's going to say, let's get you adjusted, when you feel bad, come back, okay? Because you have to know by the time you feel bad, well, that's really a time that imagine a tooth. It's already bad. It's already so bad you're back at square one. You don't want that. If you want to go from here to here, there needs to be steps to get there. Just like if you were in school, right? How do you go from kindergarten to 12th grade before you graduate? There's steps. You can't just say, oh yeah, you know what? Today's the first day of kindergarten. When you don't feel smart enough, then come back and I'll teach you some more. That's not the way to do it. So make sure you have some sort of program, and it's usually, if it's a chronic problem, there's an initial care phase program that you have to go through. Yeah, sometimes you may see you need to be seen a little bit more often. Some people need to be seen a little bit less often, all right? Now, by now, if you're watching halfway through the video, if you've liked this video so far, comment, engage with us, put comments in there, private message us if you want to schedule an appointment. Our phone number is below. But let me continue. That's not the end, okay? You gotta watch this video to the end because this is not the end. This is like halfway there. So let's say you go through a program. At the end of the program, the doctor, the chiropractor, people in the office should know where you're at. You should have at least an exam. If not, really x-rays to see where are you at now. That's what we do in our office. We have the before x-rays, then we take after ones to see, okay, this is where you're at. Now, once you've gone through the initial program to get from here to here, well, how do you stay here and how do you continue to advance? Here's what you have to know. Roughly for every year roughly, okay, for every year of damage your body has had, it's going to take about a month for it to fully heal, okay? So if you are 40 now and you got into an accident when you were 20 years old, expect it to take a while. It's not going to fully heal your body. It's one of the principles of chiropractic. If you want to look it up, 33 principles, it's number 6. It's about how your body's going to heal. There's no process that does not require time, okay? So you need to know that. Now, that's really the whole scope of it. Number 1, they're willing to sit down with you, and it's not just come in, oh, how's it going today? Oh, let's get you adjusted. It's come in, let's sit down with a consultation, because your body, there might be other things going on. Just because you have a low back problem doesn't mean your neck is great. Just because you have a neck problem doesn't mean everything in your low back is good. So as a chiropractor, you should not be only addressing just one area. And as a patient of a chiropractic patient, you really it's about the whole spine, right? So consultation, exam, x-rays, going over your x-rays, then really putting the program together and showing you how you're going to go from A to B, all right? Step by step. How do we reevaluate? There's a reevaluation exam, is it reevaluation x-rays? And then what's moving forward? What else do you have to do? What other tips are they giving you at home? Are they giving you stretches? Everything. So these are the few things that you have to do if you're looking for a great chiropractor. And if you're looking for a great one in our area, feel free to try us out, to check us out. Look, just come into our office, schedule an appointment. What's the best way to do it? You can private message us, okay? Or call our office. I think the best way to do direct contact, just call our office and we'll schedule you an appointment right then and there. Mention this video and your exam, consultation, and x-rays will all be covered for $47. $47, by the way, for exam and x-rays. You can't beat that, all right? Have a great day. Hope to see you soon.